I always liked science, and I liked the fact that in medicine you can go in, diagnose, and at times really make a dramatic improvement in someone's life. And I really like that kind of direct intervention, something that you can do and you can have an impact on somebody. Well, I'm an interventional cardiologist, and my specialty is women and heart disease and prevention. So when people come and see me, now my practice is pretty tertiary, so they're referred a lot. But what I actually ask them from the very first visit is, I've never met you, so let me have a fresh look, a fresh interaction, and look at all your medical record and your history with a new perspective. And what I ask them to do is actually give me their time. Let me have some time to get to know your case, get to know you, and sort of figure it out on my own. And I think that a lot of times when we work in centers like the Cleveland Clinic, where it's very specialized and where we get a lot of sort of complicated patients, it's often a relationship that we have to win over their trust because they've been through so many different centers and they've had differing opinions. We had a 20-year-old with congenital heart disease. And, he had been transferred, and, everyone thought he was going to pass away, and, he pulled through. He was here for like 40-some days. He pulled through. He came and saw me with his mom and dad, and I didn't even recognize him. And it was so rewarding to see him like in normal street clothes, totally looking healthy, coming back to see us in 3 months. I mean, that's a huge highlight. I mean, the nurses were crying in the ICU. I was crying in the ICU. I mean, it's so rewarding in that way to see someone who really was on the brink of death and then come back, and not just come back, but come back and have a normal life. It's so rewarding.